My pleasure to introduce the next speaker, which is Manette Le Grange, and that is from the Corporate Social Responsibility Project. She's a lead, iconic Servier, and we will listen to you and learn more about the ACT4Children role in driving drug access in collaboration, of course, with the platform. So the floor is yours. Very nice to meet you online.
Thank you so very much for the introduction. I want to just make sure that you can hear me and can see my slides. Hide them, then it seems that if I can't see the chat. Okay, so Andre, it's fantastic to follow you because you've really set the stage. And Andre has told you in many words, actually, that the stars are really aligning for childhood cancer. And with the global platform for drug access for children, we are witnessing a true turning point in the global fight against childhood cancer. It's not only for children in low and middle income countries, but it's really something that affects all children, regardless of where they live or the circumstances that they're born into. This shift isn't being driven by a miracle drug moving through clinical trials. It's something more tangible, as Andre explained to you. It is something immediate. It's a collective global step forwards in drug access that is reshaping this landscape of pediatric cancer care. You've seen the stars, and Andre has explained some of the stars in this constellation. Just in the past few months, we've seen really how the global platform for access to child cancer medicines deliver medicines to countries where treatment options have long been very scarce. And we've also seen the ACT4Children initiative introduce innovative therapies to underserved populations. And we've also seen other bold actions from industry partners, such as the application for blinatumomab for consideration as WHO essential medicine for children. So together with these efforts, have the power to expand the reach of essential pediatric cancer medicines and redefine what is possible for children with cancer around the world. And it's really for the first time now, we are not just imagining equity for child cancer care, we are actively building it. And while inequities have long been most visible in the low and middle income countries, they really affect all children. When 80% of the world's children are excluded from research and clinical development, we limit our ability to discover better, safer, and more effective treatments for every child. So closing the equity gap is not only a moral imperative, it is also essential for scientific advancement. My name is Manette Le Grange. I'm the global lead for Servier's Corporate Social Responsibility Program. We are focused on bringing our innovative proprietary medicines to children in low and middle income countries. Servier is the second largest French pharmaceutical company, but what makes the company unique is that we are owned by a not-for-profit foundation. And so without shareholders, our decisions are guided by enduring priorities, patients, the way we serve them sustainably, ethically, and with long-term impact. Importantly, in the context of today's discussion and presentation, Servier owns the only stringent regulatory authority-approved pegylated asparaginase, a long-standing cornerstone treatment for pediatric acute lymphoblastic leukemia. And these medicines are a critical component of curative treatment. We as a company are fully committed to making them available to children everywhere, regardless of geography, income, or healthcare infrastructure. And we are currently creating a brand for a highly subsidized asparaginase destined for children in low and middle income countries who currently do not have access to quality pegylated asparaginase via market authorization route. We are doing this to completely remove the financial hurdle in the way of access. And we are equally committed to doing this responsibly. Our pegylated asparaginase medicines are innovative, they're proprietary therapies, they're not generics or biosimilars, and therefore they come with complex regulatory requirements, very stringent safety standards and handling protocols. So to give every child the best chance at cure, these standards must be upheld in every setting. Ensuring safe, effective, and compliant access is not optional for us. It is a core part of our responsibility to serve patients. And that's why we work in close collaboration with regulators, clinical experts, patient advocates, and global health partners to introduce these medicines responsibly in low and middle income countries, and then to build this foundation for sustainable access. This approach is really at the heart of the ACT4Children initiative. It is to build a bridge towards this global drug access platform that Andre has explained to you. So the collaborative initiative is dedicated to improving child cancer outcomes. It's a focused public-private initiative that introduces specifically innovative child cancer medicines in low and middle income country settings in a responsible, collaborative, and sustainable way. It is hospital-based and a systems-focused model that ensures every new medicine is embedded within the quality care pathway with trained providers, appropriate protocols, patient support, and then really importantly, very rigorous pharmacovigilance. ACT4Children supports also the full continuum of care, timely diagnosis, adapted protocols, skilled clinical teams, nutritional and psychosocial support, and structured training. It, like the platform, avoids a one-size-fits-all approach by co-developing local implementation plans with the hospitals, and it generates real-world evidence, informs policy, strengthens national readiness, and very importantly, we hope to create a bridge for long-term sustainable access via the global drug access platform that Andre explained so beautifully in the previous presentation for you. The aim of the initiative is then also to bring other pharmaceutical partners, especially those pharmaceutical companies with innovative medicines, the pediatric oncology community, experts, the global logistics providers, and the advocacy community to build an ecosystem needed to deliver safe and effective treatment. And once that foundation has been securely established, then the ACT4Children medicines are transitioned to this broader platform, this WHO-led global drug access mechanism, to ensure that it is a long-term sustainable integration. We are proud to collaborate with Childhood Cancer International, IDA Foundation, the International Society of Pediatric Oncology, Resonance, World Child Cancer, and the UICC-led ATOM Coalition in doing this. In the last 4 months, ACT4Children has delivered $2.3 million worth of high-quality innovative medicines, in which the cost hurdle was completely removed and children got access to medicine for free. And we included 5 hospitals: Guatemala, El Salvador, Honduras, Armenia, and Indonesia to follow the end of this week. More than 300 healthcare professionals have been completed training, and these results really reflect what can be done if we work together in a coordinated partnership. The unavailability of essential medicines has resulted for many years in a cascade of events that has led to poor and unacceptable outcomes for children with cancer in low and middle income countries. Diagnosis is not a priority. Treatment is, in the sentence, is therefore not a priority. Treatment is compromised. Healthcare workers lack the tools and training that they need, and families receive little or no support. But most critical, governments lack the data to build strong cancer plans. In many low and middle income countries, specialized childhood cancer centers are rare. Children are treated in general wards or not treated at all. These systemic gaps cause avoidable deaths and stand in the way of every global survival goal we set. But today, we really have a global opportunity. The pharmaceutical industry must play a central role in reversing these trends, must make drug available. Over the past 3 decades, we've learned the hard truth. Innovative medicines do not naturally reach children who need them most. In their absence, desperation takes root, and with it, the spread of counterfeit and substandard products. These not only threaten outcomes, but they erode trust. It endangers the lives of children everywhere. And this is really our moment to act. As an industry and an industry representative, I'm also calling on my other industry partners. We must take responsibility, not just for creating innovative medicines and treatments, but for ensuring that they reach every child who needs them. That means sometimes removing the financial barriers completely. That means delivering quality assured medicines responsibly, no matter where in the world. And that means standing up for children who have been invisible in the system for far too long. As you could hear from the previous talk and also from the other speakers in today's webinar, the stars have aligned. It's really now up to us, also as an industry, as a global community, to rise to this moment and to change the world forever.
It was really interesting to learn more about the ACT4Children. And I took note that this is a private-public partnership and that you also emphasized on the very important opportunity to work as closely as possible with the platform. I also took note on something I think some of the other speakers will touch on today, namely that innovation and innovative medicines don't come naturally to children. And this is a very important point, as we also have this as an ambition in our initiative. So it's not a donation program. It's not only to create accessibility to the safe and safe medicine that is at hand, but it's also to address new opportunities. So I very much appreciated that approach. So thank you very, very much.